Let's take you to the Eastern Cape now, and Grey's Hospital employees in King Williamstown are adamant they will not report for duty at Bisho Hospital as instructed. They've been picketing since last Wednesday after patients with COVID-19 were admitted. The workers claim the hospital doesn't have protective equipment, let alone receiving training for the pandemic. Aviwa Mtila, my colleague, is keeping a keen eye on developments there. Let's ventilate a little bit more on some of the concerns of the employees. What are they telling you?
Well, certainly we got a chance to speak to some of those employees and the union, Nahau and Donosa, just around the issues that are plaguing Grey Hospital in King Williamstown. I understand it's a hospital, in fact, that services the villages and townships around King Williamstown. The hospital itself is a private, there's in two parts. There's a private hospital, Grey Monument, as well as a general hospital, public hospital. So in their understanding, they were told earlier on that, in fact, it would be the private hospital that would attend to COVID-19 patients, but it seems, as we heard from them, that COVID-19 patients are being attended to the general hospital as well, which they say that they don't have the protective gear and the PPE equipment, in fact, to deal with those patients. So they have been picketing, especially after the death of one of the mother who contained COVID-19, and we understand that also the children were in the hospital. So there are a number of concerns that they've raised around that. They're saying that they don't want to come to this hospital, which I am at the moment, that is Bisho Hospital, saying that they contracts obligate them to work in King Williamstown at the Grey Hospital, which now we understand, according to them, has been turned into a full COVID-19 hospital. But let's listen in on what Union Nahau and Dinosa had to say on that.
In this hospital, there's been a picketing for the past week and this week because the management have unilaterally decided to close this hospital without proper consultation of the employees working in this hospital. So therefore the fears here are that we have been having confirmed COVID patients admitted, and one died here and the suspect also died here. And the others, two 5-year-old and 11-year-old have been admitted. COVID positive patients also transferred to another place. That the most concern of the employees here is the unilateral going forward of the management without consulting the employees here. And they've been recently been told now to move to Bisho Hospital without being informed. So that's the position that we're having here.
I just want to catch up with Nahau's Mlu Ngapai as well, just to understand. We see that the employees are out in numbers, they're singing songs, of course saying they're not going to Bisho, but what are their fears?
The workers here are forced to work without adequate PPEs. They are also forced to work without the proper training. Hence now we are fighting and we are picketing outside to show our anger against this decision and recklessness from the senior management of the department. We are also now at 12 o'clock hoping to resolve this matter because there's a meeting scheduled with the Health Portfolio Committee, hoping that at least we are going to convince the department to provide workers with training so that they are able to care for the COVID-19 patients as they come into this hospital.
Aviwa, the representative from Nehau, talking about how workers are being forced to work without the necessary equipment, and he also mentions a meeting that started at midday. Do we have an update as to what is the situation at the moment?
So that meeting is continuing this very moment, Dudu, at the hall that you see behind me. I am in Bisho at the Bisho Hospital, that the workers say that they don't want to come to work. And MEC Cindy Swakomba, the health MEC in the Eastern Cape, is inside here together with the unions just to delve out the issues. We understand that the union said that they'll go back to the workers later on to give a feedback on this particular meeting. We ourselves will have an update from MEC Cindy Swakomba. We understand that she's also been in the spotlight because of recent utterances that she said during a media briefing, saying that and of course, we understand that the health minister also brought in reinforcement to the Eastern Cape because of concerns that he himself saw. So we'll be catching up with MEC Gomba as soon as the meeting that is happening inside here wraps up, just to delve into some of the issues facing not only Grey Hospital, because we understand, we heard from the unions that also Frere Hospital in East London is also having some pickets and issues around COVID-19. So just those health issues with some of the topics that we'll be delving into with the health MEC.
Some serious challenges in the Eastern Cape. We'll touch base with you as soon as we have information following that meeting. Aviwe Mtila Bisho in the Eastern Cape. Thank you.